Medical workers and first responders have been prioritized for vaccines across the country, but many unpaid family caregivers have been overlooked. Less than half of the states in the United States even mention them in their vaccine distribution plans, and that's leaving millions of people caring for vulnerable aging family members unprotected from the virus. Our Samantha-Jo is joining us live this evening from Washington, D.C. Big question we have is, where does Florida stand?
Right now, Florida is not granting priority access to those caregivers. And really that means that if you are a family member that is caring for a vulnerable senior, you are going to be grouped into that general population. And that means that it really could take months for you to be able to get a vaccine.
I'm not anybody, I don't fit in any category that is at any point been mentioned in the line of people who can get one.
What made you think of that?
I don't know.
Cheryl Bueller provides around-the-clock care for her 76-year-old father, Randy.
Kitty! Come here, Kitty.
While she has many of the same responsibilities as a professional healthcare worker, she's not eligible for the vaccine in the state of Florida.
Okay, maybe I don't have I'm not a CNA and I'm not in a facility, but am I any less a caregiver? I mean, that's my job. Honestly, the difference being I'm doing it 24 hours a day.
Randy's limited mobility, advanced Alzheimer's, and other medical issues has made getting him a vaccine logistically impossible, leaving Cheryl to face a grim reality. What would happen to her father if she gets ill?
In some ways, it seems more important for me to have one than him, because I would, in theory, be the one going out, doing things, picking up things, taking him places. And if I'm at risk, then I'm not able to help him at all.
Cheryl isn't alone. According to the AARP, around 50 million Americans take care of sick or at-risk family members. Most are unpaid and don't know when they'll be able to get vaccinated.
Like, this eligibility thing that we do in this country is really makes things really difficult for people.
Dr. Maggie Orenstein says every time a caregiver gets sick, it increases the burden on the country's healthcare system. While a few states have moved family caregivers into phase 1A of their vaccine rollouts, she says that isn't nearly enough.
The CDC needs to update their the ICIP guidelines, right? The recommendations need to change to include family caregivers. Their recommendations, the states don't have to listen, but that would be a good, I think at the federal level, that needs to happen. And then states need to include family members as healthcare workers and as essential workers.
Until then, unpaid caregivers like Cheryl remain in limbo. She says she'll take every precaution she can to keep herself and her father healthy.
He and I are pretty much all each other has. I've got him and he's got me, and we're just trudging forth, trying to do our best.
Now, a major question is, how exactly can these family members prove that they are caregivers when they go and get the vaccine? Some states like California, they actually are accepting letters from doctors as verification. Tammy?
Samantha-Jo live in our Washington, D.C. bureau. Thank you.